Hi. Hello. Hi. Can you all hear me? Dr. Gary, can you hear me?
Yeah, I can hear you loud and clear.
Alright, okay. Hi everyone. My name is Jen from Doctor on Call, and welcome to our live Q&A session. If you're new to our session, we would like to welcome you. And if you have joined our session before, welcome back. I hope everyone is staying safe at home today during this time of uncertainty. So in today's topic, we're going to talk about a very, very interesting topic, which is why do people drop dead? We have Dr. Gary here with us today from Thompson Hospital. He is a cardiologist. Hi, doctor, how are you?
Hey, great.
So today's topic, I would like you to explain more about why do people drop dead, and just give us a little bit more insight about the difference between sudden cardiac arrest and heart attack. And over to you, doctor. You may actually share the screen.
Okay, all right. Thanks, Jen. Thanks a lot for your kind introduction, and again, thank you for Doctor on Call to actually invite me to give a talk here today. I may not know many of you personally, but it's a pleasure of meeting you all virtually in the era of this pandemic of COVID-19, and of course the starting of a more stringent CMCO of the recent days as well. So allow me to bring up my slides here, and yep, I'm good to go. So yeah, my talk today, I have actually been tasked to talk about sudden cardiac death, and sort of to have a heart-to-heart talk about what is sudden cardiac death about, and at the same time also, you know, how does it affect us, as most of us would have known or would probably have heard of stories of people dying very suddenly and drop dead very suddenly, and it takes us a lot by surprise. What apparently seems to be healthy people suddenly pass off with no prelude or any pre-warning symptoms or signs. I think that's something that worries people a lot, because the anticipation and the fear of anticipating something that happens suddenly, and you, for all you know, you will never have any chance to say I love you or say hi to your loved ones. Then the very next day it becomes very frightening as well. So just to sort of start it off, I'm Gary. I'm actually working in Thompson Hospital, and this is our new hospital building, which is going to be up and about next year itself. And of course, myself has been working in other hospitals as well, but now I'm actually residing and practicing in Thompson. So what do I do in Thompson Hospital? Basically, I do with anything that has to do with heart. All right, and as we know, heart looks like this to many of us, to many laypersons out there. This is how the heart looks like, but to doctors and clinicians and medical staff, the heart looks very much different. Of course, heart to many of you will actually be used to fall in love, but to us, heart plays a very crucial and vital role in not only just falling in love, giving you emotions, but also can at the same time and ensure that your body gets its adequate supplies through the blood circulatory system itself. So with that, I always like to say I am a person who wears two caps. I'm a cardiologist. A cardiologist is basically someone who deals with heart problem, but I'm a cardiologist who wears two caps because I'm both a plumber and also an electrician. I'm sure some of you may be a bit puzzled. What do I mean by that? So basically, I deal with problems that pertains to the blood vessels of the heart itself. So if you have clogged up vessels, just like you have a clogged up piping systems in the house, you look for a plumber. But I also deal with electrical problems of the heart. So if you have abnormal rhythms, or when your heart no longer flutters when you meet your other half or your spouse or your partners, then this is a time where you need to look for an electrician. So I also deal with problems that arises with the rhythms of the heart as well. So that's why I'm always saying I'm someone who wears two caps in that matter. So if you talk about heart problems, most of us know about heart attack. And when we talk about heart attack, everyone will come to one final thing that will come to your mind is that the blood vessels are clogged up. The arteries or the blood vessels that supplies the heart are clogged up with what we say cholesterol sediments in there. And this is something, of course, the awareness is there because this is something very common. And a lot of times, people around us that we know, we do not know, or distantly we know, tends to have heart attack problems or coronary artery disease in true medical terms itself. So it basically boils down to blood vessels that is clogged up with cholesterol and a lot of other sediments there, and it impedes the blood flow. Of course, having said that, most of us, at the certain period of our life, we do realize we do have some changes that is very subtle. And these kind of changes, what we call fatty streaks, are actually not something very clinically significant. Often than not, we do not have symptoms. But it is a time when we start to have more and more comorbidities, when we have more and more other what we call cardiovascular risk factors, like when we smoke, we have diabetes, we have high blood pressures, or we have family members, the close family members who have heart problems. It puts us at substantial risk of developing a significant plaque formations within the blood vessel itself. And we only have 3 blood vessels that supplies the heart from all parts and all regions itself. So when this clogs up, then it's definitely going to impede the blood flow. And unfortunately, when we are at the time when it's mild and moderate state, most of the time we do not have symptoms. And the time when you do have symptoms where it's more of severe form, that's a time when it could be the first symptoms you ever had and can even be the very last symptoms itself. So sometimes people drop dead can be because of heart attack, or in true sense is because of clogged up blood vessels itself. All right. So, but sometimes people drop dead, and often than not, when people drop dead, you actually can be because of an electrical problems of the heart itself. So I always like to say the heart is very, very much like a house, a home, whereby you have water piping, you have electrical circuit. Sometimes if you do not have sufficient water supply to the household runs into a lot of problems, as we evidently experience it, especially those who are in the Klang Valley for the past 6 months. Interruptions, scheduled and unscheduled interruptions of the water supply itself. The same thing, if you're going to have electrical problems, you're going to have blackouts, you're going to have electrical supply shut down in a household, you're going to run into problems. We cannot do webinars like we are having now. We cannot be working from homes. We cannot even be entertaining ourselves with Netflix and so forth, and all this internet surfing and so forth. The same thing, if our heart electrical system failed, the whole heart just went into the stunted phase whereby the heart is not pumping at all. And when the heart doesn't pump, no blood will flow throughout our whole body, and that can be potentially catastrophic. So think it as a household where there's a blackout and the household can really shut down altogether itself. I'm sure most of you have heard of stories of celebrities. The very recent one, which is of course last year itself, you heard of one of the celebrities itself suddenly passed away. A very apparently healthy person who suddenly passed away itself. And of course, something closer to our shores itself, and of course, about a few months back again, another very young boy who just had passed out, had a fainting episode at the first day of school. And this is something that takes up by a lot of us by surprise, because these so-called apparently healthy people who does not have symptoms at all of chest discomfort or breathlessness and just dropping dead out of nowhere. So this is something that puzzles a lot of people. In fact, clinicians are also equally puzzled. And often than not, people always mislabeled them as having heart attack. But heart attack, we're really talking about clogged up blood vessels, clogged up arteries. But we're talking about people dropping dead suddenly in an apparently healthy people. Sometimes they are due to electrical problems of the heart. And that is what I'm going to talk to you about today a bit more itself. And this is something that really takes us by surprise as well, because it strikes you when you least expect. It can strike you when you're at rest, even like in this case, this man was found dead in a hotel room very suddenly itself, or it can strike you when you're doing something in terms of a physical exertion or emotional stresses itself. So the sheer fact that it strikes you when you least expect is the one where it is very much frightening in that manner. And this is the one form of characters of heart problems that pertains to electrical system of the heart that can always happen. It strikes you when you least expect. So let's come back to heart attack itself. Why is heart attack part of the causes of causing people to drop dead? Because when you have a heart attack, basically what happens is it's very much like a volcano erupting. You're going to get impediments of the blood supplies to the heart chamber itself, and the heart cells just die. I always say that the heart cells are not as forgiving as the cells that builds up our skin itself. Because if you were to have a skin cut, often than not, within weeks, and you put on some supplements, you put on some creams, probably your skins are going to heal very well, and you're probably not going to have any form of scar form itself. But unfortunately, the heart cells are not that forgiving, because when the heart cell sort of gets its impediment in terms of the blood supplies, the heart cells will eventually die off. And once the heart cell dies off, you realize that it heals with the scar tissue. And the scar tissue for a heart cells is actually bad news, because a scar tissue is a non-functioning part of the heart itself. As you know, the heart is made of muscles layers and layers of muscles, and these muscles layers are the one which allows the heart to pump. When the heart builds itself out of scar tissue, it's unable to pump at all. So that is whereby it will impede the blood circulation. People end up with problems what we call heart failure. If you have families or relatives that you come across and you realize that they have leg swelling, puffy face, feeling breathless when you walk about, these are the signs of heart failure. And as the heart failure sort of progresses to an end stage heart failure, this kind of symptoms happens even they're at rest, when they're not walking, when they're sitting down. They can't even complete sentence in one straight go itself. And this is the subtle sign that tells you your relatives, your friends are not doing very well because they have signs of heart failure. But let's come back to the more important context of our talk today in terms of electrical problems. This is something that most of you who have seen a doctor for complaints of chest discomfort, for pounding heartbeat, for giddiness, and for even what we call chest pain itself, I'm sure the doctors will have done something of this similarity. This is what we call an ECG. An ECG is a very specialized tool which your doctor will often than not utilize to actually look at the electrical rhythm of the heart. And if you can see over here, I'm going to point out with my pointers over here, every spike you are seeing over here, it tells you the heart is beating. And looking at this ECG, and I always say that ECG is a tool that looks at the heart from a 360-degree view. It looks at whether the heart is beating normally, it looks at the rate of the heartbeat, and at the same time, it can also tell me whether any of the three major blood vessels that supplies my heart with the oxygens and nutrients are clogged up or not. So ECG is something very important to tell me about electrical problems of the heart, and also telling me about the blood vessels of the heart as well. But sometimes we do realize when the electrical problems runs into problems, all right, when the heart rhythms goes into haywire, you get this kind of abnormal tracing. You can see that one look, even you are not medically trained, it's chaotic. It doesn't look like a normal heartbeat, as I have illustrated to you in the previous slide. This is what we call an electrical storm, potentially catastrophic. I'm sure many of you have traveled before. If you were to pay attention, a lot of sections in the airport itself would have a signage, an electrical signage, which house a very unique device. That's what we call an automated defibrillator. And these are utilized to treat when a patient drop dead and they have electrical storm with a tracing of an electrical activity that looks chaotic. Because that defibrillator, that specialized machine, is the one that's going to bring your patient from death itself. So let's look at heart disease per se in Malaysia. All right. We know that heart disease is being lumped all together into what we call ischemic heart disease. And ischemic heart disease is what we talk about, clogged up blood vessels. If in 3 years ago, when we look at this, and if you compare, even in 2007, the 10 years period of time, we realize that there's substantial increment in terms of people dying from heart disease itself. But unfortunately, in Malaysia, the statistic that is being collected in terms of heart disease or heart disease related death are usually lumped up into ischemic heart disease, which is not very true. A lot of time people who pass out, drop dead suddenly, they actually die because of electrical rhythm, and they get lumped up as a cause of death of ischemic heart disease. So the only thing that we can sort of extrapolate, or what we can indirectly deduce, is that those people who die of ischemic heart disease, a portion of them, a 54% increment here, a portion of them actually die because of electrical storm by itself. Then if you look at fast forward 2 years later, which is of recent data that is collected 2 years ago, a year ago, sorry, you realize that almost 1/5 of our population die because of heart disease. Of course, there are other causes of heart disease and so forth, but you do realize that many of them actually die because of heart disease. So if you have 5 deaths in Malaysia, 1 will be related to heart itself. And the very important aspect here, when we collected the statistic over here from the Department of Statistics in Malaysia, you realize that predominantly those who die of heart attack tends to be male predominant. It doesn't mean female doesn't die of heart attack, they do. But unfortunately, because the fact of time that they tends to have more prevalence of heart disease is the time when they reach menopause. Because before that, when they are still in a reproductive age, they are actually protected by the estrogen. And an estrogen is a female hormone that confers not only protections to many other organs, functions within the heart body itself, but also it protects the heart blood vessels as well. And of course, if you were to look at the sheer fact that at average death itself, there's 50% who die of it, and 1/5 of them actually die because of heart disease itself. So it's really a prevalent heart problems, it's really a prevalent condition that lies within our community in this local context. If you remember, I was telling you that a lot of time when people have heart disease, most of them do not have any pre-warning symptoms. And that is very dangerous. When they do not have any pre-warning symptoms, it does not alert you, and therefore it will delay you from seeing your doctor and getting things sorted out and being diagnosed. That is why we always advocate heart screening. Back then, if you would come to me 20 years ago, you do realize that heart screening is only something that is being advocated in people who are in the 4th, 5th, 6th, and 7th decades of life. But unfortunately, because the sheer fact that we are seeing people dying early now because of heart disease, that is why now heart screening is being advocated as early as the age of 3rd decade of life. So if you're in your 30s and you are actually have risk factors, these are the time you should really consider doing a heart screening, because most of the time you are fairly without symptoms, or what we call asymptomatic. So looking at the cardiovascular risk factors, and of course, many of you would have heard from talk shows, from internets, and of course from public talk, you know, high cholesterol, high sugar, which is in terms of diabetes, and of course high blood pressures are the main contributing factor to lead to people to have heart problems itself. But unfortunately, even if you have high diabetes issues, you have high cholesterol issue, you may be fairly asymptomatic. The time when you start to have loss of sensation because of diabetes related nerve damage, or the time when you start to lose your foot or your legs because of diabetic complications, is actually kind of very much at the end stage of diabetic. You want to treat early because before all these potential complications actually sets in. And how do we go about heart screening? And this is something that I'm going to expound to you and spend a bit of few minutes of yours to talk about what do we do in terms of heart screening, because heart screening is something not to be fearful of, because it's fairly non-invasive, low risk, but it gives you a wealth of information pertains to your heart condition by itself. So what do we do in heart screening? We do something what we call an ECG, and I have illustrated to you what does an ECG looks like. Basically, you will have a lot of wires hooked up on you on your chest and on your limbs, but it doesn't cause you any pain. It doesn't shock you in any way. You won't feel any slightest discomfort as well. What we do is we're going to look at this recording. We're going to key in your data and everything. Then we're going to print out the tracing and look at your heart rhythm and so forth. So this is something, a very basic test to look at how our heart performs in terms of electrical functions and in terms of the blood supplies of the heart itself. All right, so this is an ECG, so I'm going to refresh your memory itself. Then what we go on a further step is we combine the ECG with a treadmill test. So for many of you who are very active, you know, you do jogging, you do exercises, you do cycling, doing a treadmill test, it's an easy job, because basically we're just going to put you on a treadmill. We're going to increase the steepness of the slope. We're going to increase the speed of the treadmill gradually, all right? And At the same time, we're going to monitor your heart rate, monitor your ECGs, monitor the heart rhythm, and look at any subtle changes that may pinpoint to us there's something very wrong with the heart itself. Of course, when you are doing this, not only the technicians are around, which we call our nurses or our cardiovascular technicians, your doctors will also be there to monitor your progress. And if at any point of time they find that there's some subtle changes which they need to stop or render immediate treatments and things like that, they will be there to attend to you. This will be a stress test machine in real life. So basically, this is a treadmill test, very much similar to what you see in a gym setup itself. But of course, we have televisions here. In Thomson here, we have a television which displays videos, sort of distract you so that you're not going to be worried, oh, am I running enough? I'm going to be tired. Sort of distract you in a way, like what you get in a gym setup as well. And over here, this is a specialized computerized system where it allows us to monitor the heart rhythm and of course look at other parameters. For instance, your blood pressures, your heart rate, and so forth. All right. Then, how do we go a step further? Sometimes some of our patients, we realize from the initial test of ECGs and of course, a stress test itself, we realize they have abnormality in heart rhythm. Then we will take a step further, we put you on the Holter monitoring. So Holter monitoring is something that is a very miniaturized ECG machine that we can put on you and allow you to go back home and carry on with your daily routines. During these 24 hours when you are hooked up on this Holter device, you are supposed to go on with your normal routine. So it allows us to monitor your heart rate when you are sleeping, when you're working, when you're doing work, when you're driving, and when you're talking and socializing. This is something that allows us to monitor the heart rate. And what does it tell us in that manner? It tells me overall in 24 hours, what is the total heart rate of yours? It also tells me whether there's any abnormal heart rate, abnormal rhythm. At the same time, it tells me what is your minimal heart rate, what's your maximal heart rate, and what is the average heart rate of your heart rhythm. It gives me an electrical report of your electrical system of the heart itself. It also gives me a very nice chart to allow me to look at what's your rate like almost throughout the 24 hours trend by itself. It allows me to see the ECG patterns and the rhythms of it. For if you can see in this particular patient that I put out on a Holter, these are normal beat because it's very regular. But when you see something that comes in like couples like this, then you know there's something abnormal about this patient. So, and Holter monitoring allows me to look at very precisely at the electrical problems of the heart. Then, remember we're saying the heart is just like a house. So you get a plumber in, you get an electrician in, you can even get a civil engineer to come and look at the structure of the heart. So to look at the structure of the heart, a civil engineer testing in terms of the heart context, what we do is we do something called an echocardiogram. It is an ultrasound machine. I'm sure many of you have gone through pregnancies. For guys, you probably have seen your wife going for an ultrasound scan to look at your babies, your 3D scans, your 4D scans. That's the same machine that we use, but we're going to focus just right at the heart itself. So it allows us to see within the heart chamber and look at the structure of the heart, whether there's any heart failure, whether the heart is in motion, is there any problems in it, and to look at any structural abnormality in that context. So that is very different in terms of scanning, looking at pregnant or pregnancies itself as opposed to the heart itself. So using all these different heart screening tools, we will be able to sort of tell you whether you're at risk of developing cardiac arrest or even heart attack. So just for the context of or the purpose of today's talk, a sudden cardiac death can be due to a cardiac arrest or can be due to heart attack. And it's through heart screening, often than not, we can be able to group people who apparently is healthy with no symptoms, whether they're at risk of heart attack or whether they're at risk of cardiac arrest, which either of these can put you at risk of sudden cardiac death. So cardiac arrest, what is it basically about? It is about a patient who has electrical problems, an electrical shutdown or electrical abnormalities, a chaotic electrical activities that leads to your heart going into a blackout condition, just like in a household. But whereas a heart attack is pertain to a blood vessels issue, so it means your blood circulation has problems in the heart itself, therefore your heart is not getting its supply because the arteries are blocked up. This group of patients, they also can suffer from sudden cardiac death. The main important things to differentiate why people collapse, whether is it because of electrical problems or because of plumbing problems, is because the treatments and the outcomes differs substantially. All right, and sometimes if you see from dramas or series or films where you see people shocking patient out of when they collapses, those are the context of people who suffer cardiac arrest and not those who suffer heart attack. Because heart attack, you don't need to shock them with a defibrillator machine, but someone who have electrical problems, you need to shock them out of life. And if we find that from our preliminary heart screening and we realize our patient had issues with heart attack, they have blood vessels issue, then that's the time we go in for more precise investigation, what we call coronary angiograms. That's the time when we put in a very tiny tube, go all the way to the blood vessels, and then we're going to inject some dye and look at this dye will flows into our blood vessels and look at the blood vessels in real life motion. If there's a block, we're going to open it up then and prevent a potentially catastrophic complications because of an untreated and an undiagnosed condition. You can see this blood vessel looks very nice, huge, and it's flowing very nicely, so this patient has no problem. As opposed to a patient who had problems with the blood vessels, which looks like this itself. This is the right-sided blood vessels, and you can see over here, this is a nice blood vessels, but right to the point at the tail end here, it is very narrowed blood vessels. There's a very narrowed clog up blood vessels that needs to be opened up. Otherwise, patient can one day suffer a massive heart attack without them having any pre-warning symptoms. All right. So with that, I hope I did not frighten you, but sort of just give you a gist that what could potentially be avoided if we go for an early heart screening by itself. Now, if we from our preliminary test and realize patient had an issue with electrical problems, that's when I don't do an angiogram, but I do something what we call an electrophysiology study. An electrophysiology study, basically what we do, we study the electrical problems of the heart. We put in all these tiny wires into the heart, and these tiny wires allow me to see the electrical signals within the heart chamber itself. And at the same time, I can use a very specialized tool, a very advanced tool to allow me to look at the signals and pick up where is the abnormal electrical circuit and treat it once and for all. So if you have wiring problems, I correct the wiring problems, your household will be running with a perfect electrical system, and therefore you can enjoy a good functioning heart without worrying people running into a possibility of sudden cardiac arrest by itself. So just like this patient, we realize that he has actually abnormal beats like this, and this abnormal actually arises from this area. You can see how this area sort of gives out these abnormal signals. And one burn of this, we ablate it, meaning using heat and generate to take away this abnormal area. Patients are potentially cured of a potential problems once and for all without the need for medication in most contexts. At the end of the day, we know patients who die because of electrical problems, they drop dead because of electrical problems, is because they suffer what we call abnormal problems like ventricular tachycardia or ventricular fibrillation. It's a hi-fi medical term, don't worry about it. But basically, if you see, when people go into ventricular fibrillation or what we call VF, the heart is not pumping, it's just vibrating. When the heart vibrates just like this, it means there's no pumping action, the blood doesn't circulate the body, people collapses down. So this is something very worrying. If you can put a defibrillator, you shock the patient in time, the patient can be saved. But if you don't, it only takes 3 minutes before you suffer a brain damage by itself. All right. So there are also times when people have electrical problems. We do not just go in and do and burn the abnormal circuits. Sometimes they have slow heart rate and they have fainting spells. That's the time where we put in something like this. We put in a specialized battery, artificial pacemaker, and there are wires that goes all the way to the heart. These are the X-ray that looks at the heart here. You see there are these tiny wires that goes into the heart. It is a time when our native, our original electrical circuit malfunction. It goes through wear and tear. It no longer can make the heart beat in a sufficient timing. That's when we put in artificial devices like this, something like this in this manner, where you can see we put in this kind of artificial devices that allows the heart to pace in timely manners as well. So I'm going to conclude my talk here today. I'm sure many of you got a bit worried. I'm sure some of you would have some symptoms that you would have already talked to you about one after another. It may have occurred in years ago or months ago, but you may not have it. So, but if you are worried now, you do experience any chest discomfort at any point of time, or any difficulty in breathing at any point of time, near fainting or fainting spell, sensation of a fast heartbeat by itself, or tummy or neck or even arm discomfort, or you have risk factors and you're worried, you know who to look for, where to look for. At the end of the day, I always like to end it with my favorite quote. I always believe a broken heart is like a puzzle. You need to find the right person to put all these pieces of puzzle together, just like a broken heart, so that it can become one again. And often than not, that right person is really your doctor or your cardiologist. With that, thank you. I'm open to questions if you have any. And back to you, Jen.
Dr. Gary, that was very insightful and very beneficial for people to understand more about their heart. And I like what you said, the heart is actually your home. And you also talked about the difference between sudden cardiac arrest and heart attack. Sudden cardiac arrest is more on a very unresponsive side. It's where people have no blood circulation and it's very abnormal. So this one is actually people need to CPR, AED, whereas heart attack is more on the blood circulation. It's more responsive, and this one, they don't need CPR or AED. And you also mentioned that people at the age of 30 and above, they have to get their heart checked. Is that correct?
Mm-hmm. Yeah, that's right. In fact, nowadays, in this era, we are seeing people suffering from heart attack or even heart disease, electrical problems, or cardiac arrest at a very young age. In the olden days, till now, we always realize that people suffer cardiac arrest, electrical problems at a young age. But heart attack tends to be at the later part of their age itself. But nowadays, we are seeing it at a younger age. It's due to the fact that cardiovascular risk factors are being more prevalent nowadays in younger age group due to our lifestyles, due to our dietary changes, and other multiple compounding factors that sometimes are not modifiable, unfortunately.
So we are going to take a short break.
Okay,
and
sure.
After we come back, we will head over to the Q&A session. And for those who have heard Dr. Gary's explanation just now, if you have a question, please do comment on the chat box and we will revert to you shortly.
We live in a world where more people are connected than ever before. Technology has forever changed the way we connect with people to work, learn, and live. So in today's world, when the inevitable happens and you or a loved one gets sick, you should be able to connect with a doctor immediately to get the medical care and treatment you need. But more often than not, seeing a doctor for a common condition or a prescription refill can be time-consuming, inconvenient, and costly. Imagine being able to connect with a doctor within minutes. Imagine being able to talk to a doctor while at work, at home, or on the go. Discover an easy and effective way to get the medical care you need. Discover Doctor on Call, a better way to get the care you need. With Doctor on Call, you can talk to our experienced and caring doctors via video, phone, or text message whenever and wherever you are. Doctor on Call doctors are highly qualified and board certified. Our doctors will listen carefully, answer your questions, and address your concerns. We will understand your medical history, symptoms, and conditions. If medication is required, our doctors will write a prescription and advise you accordingly. We are connected seamlessly to a network of pharmacies nationwide to provide you with the prescribed medications without compromising safety and quality. You can choose to have your medication delivered straight to your doorstep, so you can spend more time recovering and getting on with your day. No waiting in lines, no appointment required, just quality medical care without ever leaving your home or office. So the next time you're feeling unwell, remember you have a doctor on call. A better way to get the care you need.
All right, and we are back to the Q&A questions. Doctor, should we start with question number 1?
Yep. From the chat, right? I'm actually looking at
Yeah.
it through when you're playing
okay.
the video promo, is it? Yep.
Oh, all right, sure. So you can.
I think we have quite a number. Thanks a lot for the questions. It's very kind of you to ask questions. It means that despite a post-lunch, we always joke about after lunch, you have surge of sugars and everything. People tend to become sleepy. It means that everyone is listening. That's why we do get questions. So that's very good. Well, I'm going to pick, there's quite a number of questions. So I'm going to pick some that is quite interesting, all right? Yeah, I think there was several, one of the questions was, I mean, a few of them are actually asking, how much does it cost for a stress test and an echocardiogram? Well, actually, to be honest, it depends on where you're doing it. So of course, different settings and different centers will be able to offer you different pricing itself. But ultimately, it doesn't matter where do you go to. But most importantly, go to someone you are comfortable with, someone who will be able to explain to you the findings itself and also lay out to you what is your next thing that you need to do once the results are out, and able to advise you also on the options you have and alternatives as well. So I'm sure now a lot of centers, even Thomson itself, also running health screening packages and things like that. Some are actually focused on females' health and some are focused on heart conditions and things like that. I'm sure you find that very competitive and you'll be able to go ahead and subscribe yourself to those packages itself. This is actually a question here, Jen. I hope to be able to answer this. What is the best way to check for blockages in our heart, angiogram or heart scan? I think the questions actually pertains to CT angio or coronary angiogram. It sounds a bit confusing, but don't worry, I'm just going to clarify in a very simplified manner for you. Basically, a coronary angiogram is a more invasive procedure. It is both a diagnostic and a therapeutic procedure. It means before we jump to a coronary angiogram, we will have decided from our basic preliminary tests like echo, stress tests, and so forth, tell us this particular person has a risk of possibly blocked vessels. Therefore, we would only then advise and advocate to go for coronary angiogram because we need to justify the risk. Although the risk, having said that, is very substantially low, but if the benefit surpasses the risk, then only we will put forth that suggestion or that form of investigative and also therapeutic option. But there are some people are actually running what we call a CT scan. CT scan of the heart itself, not CT scan of any part of the body to look at whether there's blocked vessels or not. Well, you need to tread it cautiously because CT scan alone can, the interpretation of it is very much subjective. It depends on whether the possibility or probability of you getting blood vessels are high or not. If the CT scan itself shows a normal scan, then we are very much reassured. But if a CT scan shows something very suspicious in terms of a blocked vessels and things like that, we will sometimes still need to go back to coronary angiogram to reconfirm and to treat it itself. So the utilization of a heart scan or a CT scan, it's depending on the probability of you having a blood vessels block, and of course differs from one person to another person. I hope I give you a very simplified and understanding a grasp on how do we decide angiogram or CT scan. All right. Okay, Jen, you have any burning question from your side? If not, I'll go on with the list here. Okay.
I do have one. Is during exercise, Fitbit will usually notify you that you have exceeded your recommended heart rate.
All right.
So is that something to be worried about, or is that something? Yeah.
I always like to thank the smartwatch inventors for making the life of a cardiac electrophysiologist. A cardiac electrophysiologist is basically a cardiologist like myself who specializes also in heart rhythm. Because Fitbit, it allows a lot of my patients to monitor their heart rate at home. I always say that, if you have this heart rate variability, it means to say that if your heart rate can go from a low normal heart rate to a fast heart rate, when you're doing exercises, when you're exposed to any form of emotional circumstances, it means you have good heart rate variability. And from Holter, we can see that evidently plotted on the graph. Most of the time, it means it's a good functioning heart. But there's, of course, an exception to rules, all right? But when your Fitbit starts to show that your heart rate exceeds the recommended one, what is a recommended heart rate? A recommended heart rate basically means your age minus from 220. That's the maximal targeted heart rate. But often than not, we do see healthy people can have their heart rate exceeding that maximal targeted heart rate. When we say a fast heart rate can be a normal fast heart rate, can be an abnormal fast heart rate. But in order to know, is it an abnormal fast heart rate, looking at the rate that is being represented by your Fitbit or your smartwatch itself, is only telling you 50% of the story. It doesn't tell you the rhythm, the pattern of it. In order to know the rhythm and pattern of it, you need to have a Holter monitoring. Then, if your heart is beating at 180, but that 180 is showing a normal rhythm, as evidently seen in a Holter monitoring tracing, then we can say this is a normal fast heartbeat, which is a normal response of a heart itself. All right. So a Fitbit doesn't tell you the whole story. You need a rhythm, the pattern, the recognition of the pattern itself, plus the rate together in combination. Then it gives you a better perspective on the heart condition, especially the heart rhythm. Right?
All right. We have quite a number of questions.
Yeah. Correct. I probably think we won't be able to answer all, but we're probably going to pick some very pertinent, some very interesting questions, right? I think there was one which is very interesting. I just want to talk about here. Can a heart attack or cardiac arrest cause a stroke? I think this is very interesting. All right. But let's put it this way. A stroke can occur. I'm not a neurologist, but I'm also an internal physician. So I do deal with patients who had come with stroke as well. But a stroke patient basically means they suffer from a brain attack. It's the same concept when people suffer a heart attack. When you suffer a heart attack, it means the blood supplies to the heart gets impeded. All right. The same thing, when you suffer a brain attack or a stroke, it means the blood flowing to your brain also stopped. It can happen when there's a tiny clot in the heart chamber, flies out, goes to the brain vessels and clog it up. That's one how people get a stroke. Sometimes it can be also because the blood vessels of the brain itself is actually very tiny. It itself has cholesterol built up and block off, causing a stroke. Sometimes when people suffered a heart problems, the heart stopped beating, no blood's going up to the brain cells die. They can also suffer a form of stroke as well. So yes, to simplify the answer, yes, a heart attack and a cardiac arrest can cause a stroke, but that stroke itself, the mechanism is a bit different in that context, right? I think there's also very interesting questions from one of our audience here. Can you explain why Indians have higher chance of cardiac issues, doctor? Well, honestly speaking, we do not have a head-to-head comparison. In medical field, we always like to look at robustness of our clinical data or clinical trials. When we run clinical trials, we have different levels of evidences. But when we look at statistics, we look at which ethnicity has actually higher risk of heart disease and so forth itself. It's an observational study. An observational study means there's a lot of other confounding factors. But to sort of to answer your question in that, we do find that the prevalence of diabetes kind of a bit prevalent in our Indians colleagues and Indians friends and counterparts, because when diabetes itself becomes more prevalent, diabetes itself is actually a very major risk factor for heart disease. So much so that if you have diabetes, the risk of getting heart attack is similar to a person who had heart attack before but doesn't have diabetes. So that is why sometimes when you have diabetes, we always say diabetes is a heart attack equivalent condition. So therefore, when we're talking about lifestyle changes to prevent onset of diabetes, we really mean business here, because we don't want you to have a risk of getting a heart attack just by the sheer fact of getting diabetes itself. All right?
All right.
So let's look down the list itself. I think this is also very interesting, which I probably have to talk about from the FB Live. I think someone put it up here. Why are we seeing more and more young patients? To share with you, my youngest patient, male patient who suffer heart attack, have to try to take a guess. Well, of course, you won't be able to tell me because this is not a live audience here. My youngest patient is actually 19 years old, right? And the sheer fact that he's 19 years old, but he's a very fit gentleman. He is fitter than me, and he's someone who exercises, he does everything. But he doesn't have any conventional or traditional risk factors. No family history, no diabetes, no cholesterol, no high blood pressure. But why does he suffer heart attack? He suffers heart attack because of smoking. All right. So a lot of times we are seeing younger and younger patients coming to us despite absence of traditional risk factors for heart attack. It means high blood pressure, high sugar, and high cholesterol. It's because of lifestyles and dietary. Smoking is one of the biggest culprit. We cannot say more than that. It's really because of that. And even my patient who had a heart attack, we go in, we open up the blood vessels, we put in a stent. A stent is a very tiny device. Unfortunately, I'm not able to show to you here. That stent itself can be clogged up again when they go back to smoking again. So you can see that smoking is really a huge culprit. So if you were to ask me, based on my take, I think smoking is the highest contributing factor to patients presenting with heart problem nowadays. All right. So I'll answer that question right up front. I think there's another very interesting, Jen. Sorry for, I'm sure you have a lot of burning questions.
No, you can answer that questions over there. Yeah.
Yeah. I try to maximize the time because we probably have around 8 minutes before the whole session ends. So, are heart problems inheritable? That's a very, very excellent question. I will always say that out of 10 patients of mine who comes to me with heart attack, there's probably only 1 or 2 have family history. The rest of them, none. So it is not clear-cut inheritable heart problems, all right? But if you're talking about electrical problems of the heart, we have some electrical problems of the heart that causes sudden death. For instance, I'm sure some of you will have heard of Brugada syndrome, long QT syndrome. Don't worry if you have never heard of it, but it basically means it is some forms of heart rhythm problems which can cause heart problems and cardiac arrest and sudden death. These sometimes are inheritable. It means when you have it, your close relative, your offsprings, your siblings may also have it yourself. So therefore, how do you know you have this kind of so-called genetically linked disease? The only way to know is to do heart screening. Otherwise, you may be very well. You are someone, an athlete, running up and about, running marathons, doing cyclings on Dutch highways every now and then. But for all you know, one fine day you may just collapse because you may have one of these genetically linked heart disease. All right? So I think I have it. Yeah, I think there's something called talking about the chance of allergic reaction to the dye used in CT scan. Yes, the dye or the coloring or contrast we use to sort of use for CT scans of the heart, right, can sometimes cause allergic reaction, but again, that chances is fairly remote. In a very remote chance it ever happens, we have medications that we can inject immediately that can treat the allergic reactions adequately and safely. So I don't think you should be worried about that if you ever need to go for a CT scan. All right?
Right, doctor, I have a question.
All right, sure, Jen. I think it's fair to give the pretty lady a chance to talk about, to answer her doubts. All right.
Yeah, so now that everybody is working from home, so the stress level may increase. So will that actually cause any problems with your heart?
Yeah, that's very true, And in fact, we always I mean, there's always this joke about saying that, you know, if someone breaks your heart is really broken. And there is really something called heartbroken syndrome. A medical term for it, we call it a Takotsubo cardiomyopathy. Don't worry if you don't know what is Takotsubo. Basically, it is a Japanese medical term, and it's actually talking about a device, a tool that is being used to trap octopus. All right. So we call this Takotsubo cardiomyopathy, or in short, we call it heartbroken syndrome. Happens when someone get a very severe emotional stresses or any form of stress event. So it leads to a lot of changes in the hormonal levels in our body, and it causes structural problems, and the heart becomes biggish. And it really shapes like the octopus trap that Japanese people use. So that's why we call it the Takotsubo cardiomyopathy, and it's called heartbroken syndrome. So yes, stress level to a certain extent can cause heart problems as well in terms of structural, but also it can trigger off electrical problems of the heart. Abnormal heart rhythms, palpitations, and all this can also lead to, because can be triggered because of stress events as well. So that is why we always say living healthy lifestyles, not only just talk about going exercises and things like that, but managing health, managing angers is also part and parcel of having a healthy heart in that context.
That's nice.
All right.
So, doctor, we have room for just one more question from your side.
No problem.
You can choose. Yeah, you can choose.
One.
We have one recent one that just came in, talking about.
There are devices out there to measure EKG. Will it help detect irregular heartbeat and rhythm? Is this the one? I think that's the one you're talking about.
Yes.
Yeah. Okay,
That's
great.
the recent one.
Yes. In fact, apart from thanking the smartwatch, apart from Holter, we have many other devices that we are able to look at the heart rhythm. And these devices are something that end users can buy, purchase offline and things like that. Apple Watch 4 and 5 is one of it, because they have an apps which is actually licensed by the Food and Drug Administrators in the US itself to detect abnormal heart rhythm. So that's one. We have other devices that can, like Cardia Mobile and so forth, that can also equally allows you to detect irregular heartbeat. But detection is one aspect of it. Interpretation of this so-called irregular heartbeat detected by these devices, you need to seek a medical advice on that, because sometimes you may see abnormality, but to deduce is this normal or not, is this rhythm abnormal or not, or this is a normal, then you need to see a doctor to decide on that. So yes, these devices have simplified how we follow up on patients, how we manage patients, and how we come to diagnosis of electrical problems of the heart. Yes, I do use it sometimes for some of my patients in selected group of patients, and I will also advise them on how to use it. And of course, they will have ways to send it to me for me to look at it and decide, is this rhythm abnormal or not? So therefore, I think that the treatments of electrical problems of the heart or rhythm problems of the heart has changed because of all these inventions. All right.
All right. So we would like to conclude this session. I would like to thank you, Dr. Gary, for your time to explain, and thank you for those who have attended for today's session. Also, if you all know that our Zoom is actually connected to Facebook, so if your family or your friends did not have a chance to make it, you could actually replay and watch this session in our Facebook page, which is Doctor on Call Facebook page. And also, if you would like to book a teleconsult with Dr. Gary, you may actually scan the QR code that is available on the slide, or you could also log in to doctoroncall.com.my/find-doctor. So Dr. Gary,
any parting words, is it?
Yes.
Yeah.
Any parting words? Final
sure.
pointers?
Okay. All right. Thanks a lot. Again, a big shout out to Dr. On Call for these invitations to be able to spend my afternoon here with many of you. Thanks for the very excellent questions here. I hope I can answer all, but unfortunately, because they are always time constrained. But always remember this: you have two hands, you have two ears, you have two eyes. Or you only have one heart. So take care of your heart very well. All right. With that, thanks a lot.
All right. Thank you. I hope to see you again.
Okay. Thanks, Jen. Okay. Bye.
Bye.